You're watching Let's Chat.
As we do multiple times a day, we're trying to bring you the absolute latest on the coronavirus outbreak that's got the nation and the world's attention. Right here in Hamilton County, we have got Dr. Paul Hendricks, who is with the Hamilton County Health Department. Dr. Hendricks, good to see you. April Priest joins us also in April as the Emergency Management Planner. So good morning to you both. You're the doctor. You're in the hot seat right off the bat. Where do we stand now?
Well, where we stand is we are working hard to manage this disease, try to prevent it. Right now, Hamilton County, as most people know, has had one positive case. That person is actually already recovered from that, and we're glad of that. We've been reaching out to contacts and trying to make sure that no one else has been affected by this and watching people. We're tracking a lot of the tests that are being done in the county to make sure that they come back negative and to see if this virus is spreading into our county. We know it's in Tennessee, we know it's in the country. So we're just doing the best we can to keep our people safe.
It certainly is no small task when you're looking at something like this, which, as a medical guy, again, have you ever seen a disease grip the country's attention like this?
I really never have. I mean, people have gotten upset about previous things or worried, Ebola, those kind of things, but they never had the impact of the spread or really the potential that this one does. This virus is very contagious. Whereas most people will do okay and probably won't get it, there's still going to be a large number that will get very sick, and we need to do all we can to prevent the spread of the virus.
All right, April, from the emergency management and planning standpoint, tell us where you and your team come into play on this.
So throughout the year, even in non-emergencies, we maintain several all-hazards emergency management plans. And what we are doing right now is we are reviewing those plans, and we have been meeting with our key partners such as police and fire and our hospitals to make sure that everybody is on the same page and implementing the roles and responsibilities that they are tasked with in that plan.
Dr. Hendricks, you said you had not seen anything on par with this. Part of this could be because the last huge scare we had, it seems like the government, the medical community, they had their hands around something that they could grasp and try and fix the problem. The solution here seems a little bit or a lot more elusive when it comes to the coronavirus.
Well, it is different. A lot of the outbreaks we've had in the past have been like flu. We know how to treat that. We've got medications and vaccines for that, even occasionally when a new one comes up. But this virus, at present, there's still no vaccine and there's still no specific treatment now. So the treatment remains very much addressed to symptoms and addressed to just treating the clinical condition of the patient. So and plus it's such a new virus, there's a lot of things we don't know about the we know it's very contagious, but exactly how it spreads, how long it lasts, exactly over what period it's contagious. There's still so many questions we don't have about this virus we don't have the answers to.
As a physician for decades, what scares you the most?
Well, it's the possibility of overwhelming our healthcare system. It's the possibility of having such a large number of patients at the same time that we don't have a place for them. This is why we're trying to do all we can to slow down the spread and to decrease the numbers of people we're having to take care of. We can take care of people in the appropriate numbers, but if we overwhelm the number of beds and equipment we have, that can become much more difficult.
In April, I would think from your chair, that's also a big, if not the big point of concern.
Yes, and one of the things that we can do to accomplish this and slow down the spread of this disease is to practice non-pharmaceutical interventions. And this is a term that we use in public health to help the public practice specific measures that they can do, like washing their hands, making sure that they're practicing proper respiratory etiquette, and they can make sure they're standing 6 feet away from other people, especially if the other people are exhibiting any signs of respiratory illness.
This is sort of the thing that not only creates a lot of unrest physically, a lot of people are having really difficult times emotionally and mentally grasping their head or their hands around the potential of this. What can we do to help you all with the health department spread the word?
We're trying to counter misinformation by making sure that people have reliable sources to go to get their facts from.
Misinformation like what?
We want to make sure that they're going to the hotline, for example, to call us so that we can tell them, not looking at some avenues on social media per se that maybe someone who didn't have a background in science is answering questions. And we do that. If you want to call the hotline, we have a team of leads, such as people for business, churches, schools, and outreach organizations, and you are more than welcome to get information from us, and we will direct you to a list of resources that you might be able to, credible resources that you can gain further information from.
Only a few seconds left. What are one or two of the signs that we can look for to think maybe the coronavirus has reached its peak?
Well, that's going to be difficult to know in advance. We will be watching for, if we start seeing decreases in the number of new cases daily, I think that would be encouraging, but we'd have to see that over time. There's always a concern about kind of a rebound effect as people start to feel relaxed and getting back out into
And
the
lapsing
public.
back into their old habits.
Right.
again.
So it's really going to be the kind of thing it's going to be hard to know until we've gotten there. But we will probably extend these precautions in retrospect beyond the period they need to be, but that's what you need to do. You have to be extra cautious, and that's what we're doing.
Dr. Paul Hendricks, thank you for your time. April, thank you for your time as well. And again, there has been a hotline established. If you have questions, call them at 423-209-8383. 209-8383.